Mr. Secretary, I want to truly thank you for the efforts that you have made in the state of Alaska, your visits, just the engagement that you've had with us, whether it's the Alaska Native Veterans Allotment Act, your support on the VA Mission Act to make sure that the Alaska-specific provisions in there that kind of move us away from this one-size-fits-all approach to healthcare, that they work. And I think we are seeing some very significant gains on the ground. The ability to just recruit, to retain physicians at the CBOX there and around the state. More than 100 new employees within the Alaska VA healthcare system. Dealing with the issue that we had with appointment referrals and basically getting them back to the local VA. So we are seeing some real gains on the ground, and it's got to be heartwarming for you, because it certainly is for me when I'm hearing from our veterans who are saying, you know, I've never been really happy with the care or the services, but things are turning around and they're seeing the difference. And I truly believe that you are helping to facilitate in that effort.
Thank you.
But we're also seeing the partnership with the tribes benefit as well. I think we're seeing some of the previous barriers kind of being pushed back, the delays in enrollment that we had, the denial of care, the lack of access to VA services. I do think these partnerships are yielding the benefits. I too want to focus on the mental health, behavioral health side of this, because with the issues related to suicide, and particularly with our Native people, this is significant for us. The high rates of suicide amongst Natives generally, but then you bring into it the mix with our veterans. And Senator McSally addressed this, and you really didn't speak to it, but with the published report that the VA puts out every year on suicide data, it does just put our veterans, our Native veterans, into a, quote, other category. And I think what we're learning is that lack of data, being able to differentiate that, makes it more challenging then to develop the policy responses. Later this afternoon here, we're going to be moving out 2 bills, Savannah's Act and Not Invisible, that are focused on diving into the actual data as it relates to murdered and missing Indigenous women, murdered and missing trafficked women. But until we know the numbers, we're not able to better define the solution sets. Will the VA work with us to publish the Native veteran suicide data to help us? Because it seems to me if we can get a better handle on that, it might help us in our initiatives.
Senator, we certainly pledge to you to pull that data out. As you know, we obtain from the National Death Index, the Traumatic Death Index,
right,
from the CDC. It takes us about a year to separate out the overarching veteran numbers. It took us, in preparation for this sitting, a fair length of time to separate Native American data out. I think you identify a real weakness in the way we've approached this. And if we're going to identify subpopulations, which clearly this is one, it appears that the Native American population has a suicide death rate of over 44 per 100,000, some of the highest in the nation. And there's a dramatic difference in the female Native American veteran. But we'd be happy to go through that with you, and we pledge our participation with you in this.
Well, I appreciate that. I think it's something that we need to really be drilling down a little bit more into, because it's within the Department of Justice as well. Senator Cortez Masto and I have learned this, that if they don't collect the data this way, it's tough for us. When we ask you the question and you're not able to give it to us, not because you don't want to, but because we haven't differentiated it that way. So I think it is something that we need to work on. Mr. Secretary, you mentioned the doubling of the VA reps, our Native VA reps around the state. I so thank you for that. I so appreciate it. I do think it will make a difference. But we also know that in a state like mine, where 80% of our communities are not connected by roads, these are small, isolated villages. You have to have the travel budget that goes with it. This is not a nice, cushy vacation for anybody. This is getting to work, and so being able to provide for those resources is so appreciated.
Senator Murkowski, you're absolutely right. Two things. I will work on that categorization.
Thank you.
I agree with you about the word other. Second, there is legislation that Senator Bozeman and Senator Warner have. It's Bergman and Houlihan in the House. It's bipartisan. That will do what you described. It will allow us to take grant money and get that money out into those communities, into those tribal representatives, so that they are funded to do those outreach efforts. It's absolutely essential because it's community-based and it's people who know their fellow citizens.
That is so important. I so appreciate it. I know that Senator Tester, coming from a big state like Montana, is going to make a difference to them as well. So thank you.